Hello friends, welcome to our channel Sinha, and this is our new playlist Learn Acu, and we have kept the name of the series The Elephant of Acupuncture. And let me share a quick funny story with you. I'm from India, I'm Dr. Arindam Sinha. So we have a story here where they say that they have took an elephant to China where they haven't seen the elephant, and we call it blind man's elephant. So there were actually 4 blind men who were told about the elephant, and they couldn't perceive because they can't see it. They can't just imagine there can be a beast so big. So what they did, what they could have done best, they started touching it. So there were 4 of them, and in some stories there are 6 of them, and they are different part of the story, but for my story or for the brevity of time I will stick to this. So there were these 4 blind men, some say monks. So the first one, he went near the trunk and he hold it, and for him elephant was like a big python or snake. And was he right? Yes, he was right. Was he telling a lie? Of course not. So was it the truth? Yeah, a part of it. Was it the whole truth? No. So the second one, this one went to the leg, got hold of it, and he said, oh, it's like a tree trunk, it's like a pillar. And again he was right. He perceived it. He could have proved it. He could have taken you and put your hands around the leg, and you would have also said, oh yes sir, it is like a tree trunk or pillar. What about the third one? This third one here, he said, yes, elephant, he is like a big fan or a banana leaf, because he was holding the ear. It was flappy, it was big. Again he was right. What about this last blind monk? He went near the tail, got hold of it, and was sure elephant was like a rope. The same has happened with acupuncture nowadays. In last 5 decades, acupuncture has gained popularity all over the world, and people have got their own elephant of acupuncture. Somebody has hold the trunk, now he believes in the TCM, the theories. Believing is not bad, but the thing is that now he thinks that this is the complete panacea, which it is not. Again, somebody like me who has learned Western medicine, then have learned acupuncture, he wants to stick with his Western medical diagnosis and few points. They work, yes, they work. But again, is this the whole truth? The answer is no, this is not the whole truth. So, who is right? Both of them, partially right. Now somebody says, okay, I don't want to go and so. Acupressure works. Why to go for acupuncture, invasive procedure? He is also right. This blind man has his own elephant, his own perception. So, as a student of science, we should not bind ourselves in small cubicles. We should have a broader vision. Everyone is right in their own senses. Learn from many masters. See the world as a whole. So, for today's topic, we have chosen cervical spondylitis, acupuncture in cervical spondylitis. And the problem is that people are not willing to spend time, not even the patient or the doctors, to make the correct diagnosis. Hurry is not a virtue in our field. Yeah, you can be a master, you can do certain things better than others, but give proper time. Confidence is good. If you are comfortable with pulse diagnosis, do it that way. If you are comfortable with the Western medical diagnosis, you can look at the MRIs and all, use them. But please make a diagnosis whatever way you can, and then you can treat. For cervical spondylitis, I have chosen to keep my lectures on the muscles only, and today we are going to take a big muscle, that is the trapezius, which in most cases is involved in cervical spondylitis or neck shoulder syndrome, and today we'll be talking about that. So as in the next slide you can see, so this is trapezius, and actually if you're comfortable with this is the front part of this above the clavicle. You can just see, if you see from the front, you can just see this part. So we also call it shawl muscle. So if you put a shawl, so some part of the shawl is in front of you, and that is this waiting here just near your neck. But to see its real beauty and its extent, look at this diagram. It's from the back, and yes, of course the skin is not there, not to worry. And as you can see, this red part is the trapezius muscle. In certain new classification, they have started calling it these fibers upper trap. Okay, these are middle trap. Oh sorry, I can't now change. These are middle trap and these are lower trap. So this is trapezius, beautiful muscle. Here it is on the spine of the scapula and the spinal process occiput. So as you have seen, so when this muscle is in spasm, how will you know? You should know the actual function of the trapezius. The first thing you can see, you can ask a patient to shrug his shoulders like this. What it does is this: when it contracts, these parts actually do that. Now, if these part contract, it will pull your head towards the shoulder. Okay, and if this part contracts, it will move your scapula. You move your scapula behind. Okay, so these are these three functions by which you can see, and if this one, this part, if it works, it will extend your neck. Beautiful function of trapezius. So just see this movement in your patient, and if these are hampered, for sure trapezius is involved, and then you can use these acupuncture points, which I am going to tell you in the next slide. The most important of them is GB20. It's just here, yeah, behind the mastoid process. Okay, and you can use it. It works beautifully, and it's also a point which acts on sternocleidomastoid, which is often involved in these processes with trapezius. Then you can have this pillar point. Many of you have loved this. Acupressure works wonder on this. Acupuncture is also very good. This is UV10 on the level of C1, C2. Then you can have this master endocrine point, we call them GB21. Okay, I think you can appreciate this point here. So the highest point. Okay, and last but not the list is Sanjiao 15 or triple Wormel 15 or triple burner 15, whatever you have read in your books. This point, this is just on the supraspinatus, part, but it is actually the trapezius which also get benefited from piercing this point. So you can use any of them. So most of my students ask me, sir, we should use Bu or Shi, that is the sedation or tonification method, while using the needles in acupuncture. My simple advice will here be that if you're not sure, then please use the sedation, because muscle is already in you say over tonified state. That's why the pain is there. So use the sedation in these points. Okay, how deep you have to go, that depends. And this point, please be very aware of this. This is GB21. In certain books it is called dangerous point. Why they call it dangerous point? Because if you somehow take a long needle and you go deep inside, there are chances, though very rare, that you may reach the apex of the lung and you can do damage. So while doing this, be sure that you are in trapezius. The goal while doing acupuncture on GB21 should be to know this muscle and to pierce this muscle only. And please take a look on the direction of the fibers. They are very helpful while doing this process. So today I am ending my lecture on this thing only. For next lecture, join our Sinacure channel on YouTube. Thank you.